Good afternoon everyone, and welcome to our panel interview on the connectivity between the dental practice and the dental laboratory. And thank you to our panel members, Dr. Colin Campbell and Mark Melbourne, for joining us this afternoon. Dr. Colin Campbell is the owner of the Campbell Clinic in Nottingham, and he has placed over 5,000 implants and carried out over 10,000 surgical procedures. He is also responsible for education and healthcare professionals in implant dentistry and has personally developed many courses in this field. Mark Melbourne is a registered CDT dental technician. He was one of the first to qualify at the Royal College of Surgeons in the UK. And this enables him to work directly with patients who require dentures. Has extensive experience in working with oral surgeons and dentists with denture stabilisation. Delighted to welcome you both here this afternoon to answer one or two questions on this topic. So let's move on to the questions. And first one I'd like to pose to you both is the last couple of years has seen a dramatic increase in not only general interest but a greater willingness to invest in digital equipment, both laboratory and chairside. What do you think is the main driving force behind this? Clinical predictability and control, patient experience, is it financial, or is it a combination of all three?
Do you want to go first on me?
Well, I'll go first, if you don't mind.
No, you do it. Go on.
It must be a combination of all three, and it depends on the individual setup, the laboratory and practitioner setup, as to why do we go forward. Certainly, we've experienced a level of productivity within the lab, I think, we wouldn't have been able to secure without the digital investment. So the things that we can do in our laboratory setup, which is small in the lab, but we can do an astonishing amount of work that we probably wouldn't be able to do together without the digital equipment that we have.
No, not the communication-wise, no.
Yeah, and so the patient experience has definitely improved in various aspects with the guided surgery stuff that we're able to do, with the restorations that we're able to provide, with the customization we're able to do. That's definitely better. The outcomes are better, particularly through the guided surgery stuff from our point of view. And financially, once you get over a certain level, then there are clear financial benefits, I think, through economies of scale and through efficiency with the digital stuff, I think.
Yeah, I mean, for me, I think there's a sense of confidence that's arisen, really. There's a point where, the digital stuff was out there, but it wasn't very integrated. It looked quite good at doing certain things, but the whole system itself was a bit hodgepodge. And I think now there's a bit more of a confidence about it. So that confidence means more people are getting involved in it, more people get more of a buzz about it all. And it can deliver now. The systems can deliver, where at one time you kind of was a bit of a gamble about what could it do.
It's a bit more predictable in
terms
of the overall workflow.
Yeah, I mean, there's still a lot of room for improvement, but it's got to this point now where the level of confidence, what you can achieve now, is something you can show, something you can deliver, which is quite a...
And people in our situation, I think, are happy to sort of share that and show colleagues and people in the profession what we think is working and what isn't working, and then that leads on again, because that increases the confidence, so people will then say, well, actually, we can see that they're making that work, so we're happy to invest in it, and then they're able to do stuff and show other people that it's working. And so it's tipping towards a point where people are saying this is some aspects are now essential for practice, not even just as not just an add-on or something like a luxury. That some aspects of digital stuff is now becoming essential, really.
Yeah.
I think the Colin Campbell Clinic, you were one of the first to take this lead in making this investment in digital technology a number of years ago, in terms of making a significant investment, not only chairside but also from a laboratory side. And we're seeing this more and more with more specialised clinics around the country, in terms of seeing the benefit of having an on-site technician.
Yeah.
How do you find that affects the day-to-day business?
I've got a couple of hats on, really. From a clinical dental technician point hat on, it was when I trained as that, coming into the practice, that was to work with a team approach. That was to get confidence from the clinicians around there and to be supported was a big thing. And there's a technician to actually be a part of the practice is something quite wonderful. It certainly breaks that barrier that there used to be them and us. And when you're working in the practice, it's just amazing how much you get relied upon, you get questions asked, and there's a really good rapport between the clinicians.
You can bounce off each other.
And you certainly situations come through, because sometimes you just need more than one person's vision. And you can be tunnel vision, and if there's a separation between that, it just gets even increased. But if you're in a group together and you can discuss things, and I mean, we're all talking about here, the patient's actually what we're talking about. We're not talking about our own egos and we're all coming together to do what's the best result we can for the patient. And to do that in a team environment, I just think it's a natural way to go. In anything, it should be how it should have been a long while ago.
And the digital technology makes that process a lot easier, a lot more streamlined.
Yeah, well, as a laboratory,
from start to finish.
We're getting to the point now where your whole swathes of technical things you used to have to do in the laboratory are just redundant now. So you can have a small amount of equipment that does the digital work, and a technician there, and the amount of that, a technician that can do the job well and knows familiar with the system, the amount of work that one guy can do for a practice is phenomenal. You don't need a raft of people all waxing away at crowns like they used to and things like that.
Or casting models, sectioning models,
all these sort of things are out the window now to
yeah.
some degree.
So you can concentrate on what you're good at in terms of the technician skills.
Yeah, and I think there's a catch-up in terms of technicians actually getting on board with that. As a technician, I'd be knocking on surgeons' doors and saying, you know what, I could offer my services here in your practice. You get a communication going on that there. It'd be quite revolutionary time, I think, really.
Yeah, no, absolutely.
I think I can't see any other way for quality high-end practices in the next 10 years to go. I can't see them function without this system in place. I just think it's a natural progression, and I think that this model of this integrated digital model with a multi-surgery practice with all the skills available to provide the range of treatment, and one of the key elements of that is the laboratory. It's not a luxury.
Essential,
it's not.
I mean, how many hats can you wear? You can't wear that many hats, can you? In a practice?
And one of the difficulties is that the owner-operator guy will invest in digital, but he clearly doesn't have the time to learn it, and because there's a big learning curve, and it's a practice and learning-based environment. And so you have to get someone that you trust and say, please, can you do that side of things, and so that I can concentrate on the bit I do, and that's what we have done. So I don't know anything about restorative dentistry at all, and I don't pretend to. I'm a surgeon, and I do the surgery side of things, and the technical side of things is handled by Mark and Marta, who's our other technician, and the restorative side of things is handled by the restorative guys, and that it's too complicated to work any other way. There is a economy of scale that you'll have to get over in order to be able to provide this, and I think it will rationalise into practices of a specific size with these facilities. I think realistically that's where dentistry will go.
Well, absolutely. And I think it's whether it's something that's straightforward, a single visit, inlay, onlay, crown, right through to the more complex cases that you guys are doing. That system gives you the flexibility, whether it's implant related, whether it's orthodontic related, whether it's restorative related. And I think we've got to bear in mind with this technology, it is, like quite rightly you say, it is a tool at the end of the day. It's very, very capable, but it's a question of education, training to get the most out of it.
Well, you've got technicians, you're trained in sort of restorative aesthetics. You're right there as part of your whole training procedures on that. And in dental practice, traditionally having the CEREC machine, and then this is no slight against dental nurses, because what they do is an amazing job. But to just then suddenly pass it on, you go and glaze up some crowns, you go and do that, it just means that the system's not being taken advantage of. And the person who actually needs a passion, so it could be a hobbyist, it could be whatever, but the person who starts to use that digital, it needs to have a passion for it. Needs to want to go and use the best they can for that. It's not just a tool that they just go and, here we go, slap something out. So it needs to have a bit of connection with what you're doing on that there. And it can be anybody in the practice could do that, but that initial connection needs to be there to do that.
With the right training, with the right guidance.
It needs to be there.
It's amazing what can be achieved from it. How do you see this technology benefiting the NHS market? Do you think that's a little bit early at this stage, or do you think that might come in?
There's guys doing this already with CEREC in London. I think we have to move away from this fee per item mindset in the National Health Service. That doesn't exist anymore. Practices are paid a global sum of money to provide treatment for patients. End of story. So I think the ability to provide good quality, effective restorations that are long-lasting for patients is essential, and that absolutely can be done with digital dentistry. And if you can provide posterior CEREC restorations for patients instead of, I mean, they've recently announced that they're phasing out amalgam, so you're going to have to replace it with something. And if you can do, cost-effective crowns for patients digitally in a single visit, why, that, if you thought back to panoramic radiographs in the 1980s and 90s, that was first of all thought to be the province of private dentists, and now you really wouldn't have a practice without panoramic radiographic capability. It's the same sort of thing. It will just infiltrate its way in, and there will be a law of diffusion of innovation that applies to it, and early adopters in the NHS who have group practices will invest in it because they'll see that it will increase efficiency, and then other people will follow as early adopters and late adopters. I think it's inevitable that will happen.
Yeah, well, I think this is something that Sirona started many years ago as a digital impression, and as we all know, the foundation of all these clinical outcomes, the foundation is the digital impression.
Yeah.
And that's where it all starts. And we've seen tremendous advancements in the way the intraoral scanners are operating, how smooth they are, the way they scan, and I think that's the way in for a lot of people initially, is to start with the intraoral scanner and move.
We booked
forward.
Through our teaching program. We booked some guys from the University of Zurich, and we've seen them on a couple of occasions, and that's where CEREC started, was Zurich. And the dental students at Zurich make 50 CAD/CAM crowns in their undergraduate year on CEREC, and they also make them on other platforms. And so, in a lot of respects, we're way behind that in this country, and so there can only be a development towards that. Dental schools are now starting to look at and understanding that training their undergraduates in digital technology is an essential way forwards. It's just starting to really tip over and infiltrate into mainstream now. It used to be the best kept secret, CEREC, didn't it? And it's not a secret anymore.
Well, that's great. Well, thank you both for joining us this afternoon, and it's very interesting to get your feedback on these topics.
Thanks very much.
Thank you.
Cheers.